Thanks for joining, everyone. I know a couple of you guys we have been already discussing with and having discussions on project specifics. And right now, we just wanted to share things or the outcomes that we had with after a couple of meetings with the advisory boards and the venture capitalists and the financial investors. And one of the main things that they have come back to us is there is a huge amount of money which is available for startups who want to basically help fight the crisis for COVID-19. And there are a couple of areas that are majorly impacted. And we are looking for people who come up with their ideas and put it forward. And we can help as open consulting and help out on the other things, on the other things about getting you the support which is needed to basically convert your idea into a complete solution. This is just a brief further from the chat we had on the WhatsApp groups. Is the advisory board has come up and they have actually already secured around 100 crores, which is over 10 million pounds in grant for startups, and they are not asking for any equity or business interest. So this is a great opportunity even for startups that you don't have to lose any equity as long as and you can get access to this money as long as you can prove that you're doing something to basically affect a positive effect in one of these six areas. And I'll definitely cover up these six areas are the ones which will get your project maximum attention and most probably a quick turnaround as well. So previously startups used to come up with their ideas and it used to take them around 6 to 12 months just to get the right funding. Until that duration, they had to do the funding on themselves. Now we are actually talking about getting the funding available to the startups within a couple of weeks just because of COVID-19. And these are just the six main areas which we are focusing on right now. It doesn't mean if your idea is for any another project which is outside of these six areas, your ideas are still welcome, and we'll definitely work with you to find the right partnership or the sponsorship for that. Going back to the presentation for today, this is just based upon the data which has been analyzed over the last couple of weeks. This is on the left hand side, what you're seeing is a sudden increase in the online traffic for a lot of industries like telecom, media, retail, healthcare, also the supermarkets, which are online. And that from this just on a weekly basis comparison. And just as soon as the lockdown has started, we have seen a tremendous growth in the demand. And if you compare it on the right hand side, there are other industries which have seen a sudden decline, including jewelry and watch sector, luxury segment, the fashion industry itself, sports entertainment, sports equipment, and also the entertainment and events, so gigs and musical fest, everything has dropped drastically, and also on the tourism front as well. Uh, if you look at the trend in the insurance sector itself, the life insurance, term insurance, and the vehicle insurance, this is just the search trend from Google to highlight as to how things have actually dropped suddenly in March and April. And this is just another one looking at the car and bike insurance searches. Health insurance is also seeing a sudden decline because people are pretty much just stuck inside their house and they are not looking for any more of extra insurance cover. What we have seen is there's an unexpected demand for online services such as personal care, hygiene, baby care, ready to eat online ordering, even mosquito repellent or anything to do with sanitation or hygiene, also mobile wallets. And what you've seen is sudden growth in a lot of different areas, which is quite predictable, like hand sanitizer has grown, that industry has gone up by 1425%. Face mask grew over 4 times. Hand washing products have gone up 86%. Floor cleaning. The most of the hygiene product we've seen a massive um, consumer uh, behavioral change over the last few weeks. If you look at the supermarkets, food delivery, and grocery deliveries, that has spiked up just as soon as the lockdown started. What this is highlighting is the whole market trend is moving in a completely different direction. And this is just the starting point. It will continue for a very long duration because the lockdown right now is only for 21 days. That is just the hard lockdown, would prevent the medical systems or the health services to be able to cope up with all the demand. But this lockdown is not just going to stop at 21 days. After that, things will start easing up, but then the easing will not happen in all the industries. So what we have seen is a lot of other industries are seeing already a massive drop in their demand. So anything which has got apparels or clothing, that has gone down already. Even online sales of the clothing have come down, because if you're pretty much sitting at home, you will be in your pajamas. You will not be looking for designer clothes to go out. And same thing has happened with the travel industry. All the demand has pretty much gone away. And if you look at another side of it, that is what is going up online and on social media, you're seeing a lot of extra demand for yoga online or yoga videos, or basically anything to keep yourself fit while you're at home. And also suddenly there's a demand for haircut at home searches as well as to how to do haircut at home. That's just 1 week of lockdown. So the whole social behavior is moving and changing. And what we're bringing together is with the with this community of contractors and consultants, we have got a lot of demand in place, which or a lot of projects which are coming up right now, which are looking to solve the problem of common people. So uh, the main thing we are looking at is a lot of things are moving towards online. Also on the digital marketing, plus a lot of apps are being developed. But anything which is affecting the current COVID-19 is going to get a high traction. So that's why we have asked for, if you have got any business idea, anything that is requiring a transformation in the existing product or the behavior, or if it requires a simple repurposing. So I'll give you a simple example as to how things have moved just in the last couple of days. Is as soon as I can find the right slide for that. Know that I'm not able to find it, but so the thing is that suddenly a couple of sectors have been, government is already looking at giving them more powers, or basically allowing them to do beyond what they were doing. So things like alcohol industry, which so hand sanitizers previously were supposed to have only, they used to be alcohol-free hand sanitizers, but because of COVID-19 requirements, hand sanitizers need to be having 80% alcohol in it. So a lot of alcohol manufacturers are now being given a license to start manufacturing hand sanitizers. This is just a simple example of how an existing industry which was shut down, that will be allowed to reopen now, because the industry trend is moving, and that is where the demand is. And so what we have done is we have started discussing these projects, and with the investor community, they have come back to us saying, you have got such a big community of contractors and consultants. If you have got any business ideas or any ideas to help or prevention of COVID-19 spreading out, that will be really helpful. It could be a simple app. It could be anything that can help people stay inside, or even if they are outside, how do we prevent it from spreading? One of the main things that a lot of industrialists and business owners are looking for is restarting their business. So they have been in lockdown. They know they will be in lockdown for another 2 weeks. But after that, they want to restart their businesses. They want to start bringing in their employees to the workplace. How can the businesses make sure that the virus is not spread once they start opening up their businesses? So there have been a lot of at the government regulatory bodies. There's been now talks of creating a COVID-19 community or COVID-19 department inside every organization. The responsibility of that department will be basically similar to HR, making sure there are policies and procedures in place to prevent the spread of the virus, maintaining the social distance, also maintaining the hygiene of the organization, plus a couple of technology solutions behind it as well. One of the typical example is where you have board meetings which need to happen face to face because of mostly security reasons or the criticality of the business. And there is a huge demand over there for companies to make sure that everything is sanitized and the board members are all have got a clearance that they can actually attend the meeting, and nobody else in that meeting has been tested positive or has been in contact with anybody else who has been tested positive. So this is just one area where prevention is the main thing. Another area is scaling of the testing for the disease as well, plus the management of disease at home. And this is the area where they're looking at if people are self-quarantining themselves, and but not everybody else inside the home is right now tested positive or affected. So how can you manage the disease at home so that it is not creating an extra burden on the hospitals or NHS? And another area is enhanced support for healthcare workers and hospitals. So this is where the healthcare workers are already stressed out and they are working around 20 hours per day, and they want a lot of support as well. So there's any kind of project or any kind of tool which can help support for the healthcare workers and also to the hospitals, even if it is just a simple queue management or anything to do with their time management. Those kind of things, those kind of project ideas are also welcome. Another area which has been critically looked at is management of critically ill patients, as to their information being shared, as to how much we can control their health and what other things can we do, especially for the vulnerable people, elderly people, pregnant ladies, and that whole vulnerable section of the society. And another major area which we have seen recently, just after 7 days of lockdown, is support for mental health. Because if you are staying in a home, you're happy, you have got a nice family around it, everything looks good. But if you're staying in a home with with just a couple always fighting all the time, and now you are locked down inside the same home, same couple, it's causing a lot of mental health issues. Previously, people used to just walk out, talk to their friends, move around, and they used to manage these things on their own. But now there's a lot of support required even for mental health. So these are, I would say, 6 key areas where we are looking for projects. And there are definitely a lot of other areas where we are welcoming people to come up with their ideas and projects they would like to discuss and work on. And what open consulting is bringing in is we are providing this help and support for you to launch your product. So it could be taking from your idea, pitching it out to the venture capitalist or the investor community, helping you arrange the execution team behind it, also to get it into the sales and marketing pipeline, plus to get it to the right people so that it can be implemented. So kind of rollout when it is going out on a global level. So open consulting is helping out on all of those aspects to you. I see a couple of questions have been put in chat, so I'll just bring that up. I'll not be speaking a lot on this session. I'll let people discuss more. So I think everybody can unmute yourself and talk. But let's go to the questions first, and then we can look at this. So Kiran has asked, can we submit an idea for funding the company is if the company is registered in the US? Definitely you can submit it. Company registration address doesn't make any difference because COVID-19 is affecting everybody globally. So it is, you can definitely submit an idea. It could be that your company registration address frankly has got nothing to do with it. Ooh, not able to hear you. Okay, that was exactly at 12:05. That's when we started. If it helps, my company is making websites. So Fazi, yes, you're promoting your website, definitely. If you're looking only for website and things, we'll do. Business cards, I don't think so anybody is doing it nowadays, but definitely we can look in that. Will the slides for the recording will be shared? Yes, slides and the whole audio recording will be shared on YouTube as we did with the last Wednesday one as well. Anybody else, feel free to ask questions. I'll just give people some time to write down your questions in the chat or feel free to ask it as well. So by the time people come up with their questions, find the right place to ask it. Just want to share, just in last 3 days from our last session on Wednesday, we have received a couple of project ideas. People have come forward and discussed it with us. Pretty much everybody who has submitted a project idea, we had a discussion with them already. There are a couple of them which are directly directly focused on COVID-19 and especially in the UK market. So we are already looking at that, and we are already discussing with them. And after that, we are basically putting them forward directly to the venture capitalists or private investors. I see a couple of extra questions have come in. MS, I'm not sure what your name is, but before presenting my idea, can we sign an NDA with Open Consulting? Surely you can sign an NDA with us. I mean, we've got no issues. We are not discussing your ideas with anybody else without your permission. And Open Consulting is just facilitating things for you. So Ashok has asked, I'm into X-ray tech, low-cost X-ray CT combined with AI, but will be a major diagnostic. AI will be a major diagnostic equipment. Can this high tech be funded too? Surely, Ashok, there is a possibility of funding it. We are looking at projects right now which can be implemented in next 1 to 3 months. So if a project requires a longer duration, then that needs to be looked at separately, because that could be having an impact, but not an immediate one. But definitely we can have a discussion on that, Ashok. Shailesh, you have said I can help with cloud migration for companies looking to migrate their on-prem infrastructure, as we are cloud solution provider for Microsoft. Thanks for letting know, Shailesh. We are definitely, when you're developing a solution, technology is just a minor part of it. And you can definitely help on the cloud migration if that is required. But right now, most of the things that we're looking for is end-to-end solutions. So think beyond your technology, because technology is just, I would say, less than 5% of the solution. When you're thinking of a solution, you need to think end to end. I'll give a simple example of how things are happening across the industry. So if you look back at how things have started, or how the businesses have started opening up in Hong Kong, every employee who comes in, they're into a building which is more crowded or where there are a lot of people. The employee's temperature needs to be checked. If it is more than 100.4 degrees Fahrenheit, they will be asked to go back home. If it is less than that, they are allowed inside, but inside as well, there's on the entry into the building, there is a sanitization station where people need to sanitize themselves so that they don't bring in any virus from outside. After that, they are working inside the building. They are maintaining a distance of 6 feet, that is 2 meters, with their colleagues. I've seen there's pretty much the whole pantry has been cleaned, and everything is now sanitized and single use. So there is a huge change which is happening inside the organization. Definitely technology is being used over there. People are using technology to monitor the spread of the virus and to for the healthcare. So think of not just technology, think beyond technology, think of complete solutions which can be provided as a project. So I'm seeing a couple of ideas which have been put up here, but then websites, X-ray technology, cloud migrations, these are all technology based. Think more and think beyond. Another follow-up from Ashok is X-ray with AI can be done within a month. We are working on it. POC is done. I'm a BIRC grantee for developing a low-cost X-ray detector. That's really good, Ashok. If you're already ahead, that's a very important part. We can definitely get you aligned with the investors. So if you can, all we are asking for is just provide a one-pager of your idea. Send it out to idea@openconsultinguk.com. The email has been provided over here, and send it out to us. We will definitely give you a call back to discuss it one-to-one. And after that, we can talk about how do we take it forward to the investor community. So just for everyone, you don't have to just type. If you are interested, you can definitely, you can speak as well. You can just unmute and you can speak and ask a question. The last point which has been mentioned by Fayaz is a very, very important point is, I guess, even discussing specific problems people are facing during lockdown can stimulate ideas. So that is exactly how we had a couple of discussions recently, is if you're trying to solve a problem, if you're trying to create a solution, just look inside your own home, look inside your own day-to-day life, look at the kind of problems that you are facing and try to find a solution for that problem. What could be a solution? So if that solution can work for you, you're not alone on this planet. It can work for a lot of other people around the globe. So if you're just stuck inside the house, one of the simple solutions is you cannot play cricket, but you can definitely play an online game. And when you're playing games, your brain gets stimulated and you're able to do basically release your energy as well. There are lots of these kind of business ideas which are coming up. I've seen a tremendous growth in the number of videos which are uploaded by people on YouTube to promote fitness at home, kind of exercises you can do at home, yoga you can do at home. And these people are actually starting a complete new business, because YouTube is a proper business. Once you reach 1,000 subscribers, you can actually start making money from YouTube as well. So they are actually starting their social media business. And look at the education sector, as to a lot of people have got kids and the kids have to be sitting at home. So why not to get them engaged and into learning something instead of kids just watching Peppa Pig or just movies all the time. So there's a lot of movement which is happening into education technologies as well, wherein not just kids watching the videos, kids are having one-to-one interaction. A lot of schools have started adopting Google Classroom, and a lot of tuition centers or 11 plus exam preparation companies, they've started doing Zoom session to coach bunch of students in one go as well. So education technology is another area where we are seeing huge shift.
Hi, and I think this is Shanti speaking.
Hey, Shanti.
Hi, thanks. I mean, it's a very nice presentation and the slides wise and the explanation of each and every topic that you have done. It's very good effort. Thanks for that. I got one aspect to, we might have covered it or not, about this tying up with, doctors to do telemedicine sessions to the in-house patients. Maybe in the point number 5 or point number 6 might have covered that, but it has come to my personal experience wise. Back home, parents are the aged and ill, but they are suffering from some ailments which cannot go and see the doctor because the transportation is closed and etc. So they had to actually check with the local RMPs and to get immediate, the remedies wise, because they have got some stock in our villages. So any telemedicine help, tying up with the doctors and, rotate over in a different times and sessions and with the patients, that might actually help. In my parents' case, it has helped. So they actually tied up with the RMP has referred to the main doctor in a town, and they further put into the city. So they had a conference session on a tab. It had worked, and my mother has to go in an auto to the auto to the near town to the medical shop, get the medicine up. So this took almost 2.5 to 3 days to get the medicine and start working. Because so I have to actually start the chain of action. So this might actually help. This is actually a real-time scenario I'm talking about.
Absolutely correct. I totally agree with that. Even my parents are back home and they are pretty much locked in on their own. Of course, they both are there together for each other, but still, if they generally used to get their blood pressure checked or their diabetes checks done, now pretty much they are stuck at home. So there's nobody who can come and do the checks for them. And yes, definitely video consultation is something which there's no centralized system at this point, but definitely that's a great idea. I would suggest if you can write it down as a business case as to how this solution should work, and we can definitely take it forward.
Yeah, thank you. This is one of the things I have come across, and also, back home, tied up with a local cloth merchant and these metal merchant, and just started doing the local lent with the family, friends, 2-3 sewing machines, trying to do the in-house, the gloves and masks, and also serving the food for the within the villages. So with the hygiene maintenance, so that these things are actually working for the past 15 days. They are actually distributing the masks to the elderly and needed, and the volunteers actually going into the streets and distributing it. So this kind of tying up back to the home and the villages, definitely it works in a great deal. because I mean, the people back home, they are, particularly in villages, if you tell them in a right way, this is the threat, they listen. Mostly the people who are not listening are the educated people.
Absolutely correct. I totally agree to that. And yes, we all have been following the news across the globe. So, in comparison, yes, that is the kind of behavior. And I think that is the same thing which is probably far better managed in UK, in India, than I would say it's the way it is managed in US and most of the other countries. And yeah, there are a lot of efforts already going on things on the voluntary basis across the globe. Even in UK, we have started working on distribution of food and groceries for the elderly who cannot leave their house. We have started doing it. Previously, we were just doing on free delivery, so just pick up and deliver at their place. But now we have started giving free grocery to them as well in our area. So that is, all these things are happening as well. But any kind of these ideas, anything in to favor and to support the community, they're very, very welcome.
Who was that speaking? Was that Natik?
Yes, there's Natik here.
Yeah, hi Natik. This is Manish. So on that front, I mean, if you guys are doing deliveries and those kind of things, just on a volunteer basis, I've also, I mean, separate to the discussion, but I'm also available or happy to help out in that sense.
Sure, I would suggest to look on Nextdoor app. Nextdoor is a great app which is used as soon as I find the chat.
Yeah, yeah, I use that.
Yeah, so we are using Nextdoor. Yeah.
There's always 50 helpers for one request, so that's a good thing.
Yeah. So once you start helping out, you start building the community, and that's when people start relying on you, and you start building that community. So it definitely helps. We in our area, we're using Nextdoor.
Oh, okay.
Naitik, the funding that you're talking about, is it actually in a UK or India? I mean, when you mentioned it's a rupees 100 crore and the pounds, I mean, where actually the funding is coming from?
So funding is available from Government of India, and it is also not just Government of India. Government of India is controlling the funding, but the people who are providing it are the venture capitalist community and the founders community and the TIE board. So this is TIE's investors executive or something. So they have come up together. They have brought together 1,000 crores in India for these kind of projects. And even in UK, they are willing to even support the projects which are in UK. The company and the location doesn't matter, because the virus is spreading globally. So even if you have a project in UK, which is helping out on any of these 6 areas, definitely the funding is available even for us.
Yeah. One more thing just wanted to discuss about. See, is you got the RCX cars, right? I mean, you got children play with the cars, remote control cars.
That's correct.
And you also have cars in different sizes, but you still operate within the household. If someone is actually locked down within the home itself, you're actually isolating in a separate room. Probably you can use remote control cars to actually put something on it and then control using the remote. Probably that's a kind of a semi-automation in towards the robotics kind of thing. But you may say your creativity is the goal basically. So this has actually been I was doing kind of a while ago, but I mean this could actually go into the corners of the house and then put it there, and people who are actually suffering probably can take it out. You can do the sanitization of that car, and you can do the normal stuff basically.
Absolutely correct. I mean that's a great idea. You don't have to be exposed to the area which is virus infected, or remote control cars is one area. Another one in US, they are using autonomous vehicles as well. So these are the vehicles which can drive on their own and they can deliver the products. And they're already starting to use that. Of course, it depends upon how much of these kind of vehicles or these, I would say, delivery mechanisms are available to people and how much they can use it.
Other thing is, most people are actually very much glued to the gardening nowadays. And say, for example, planting the potatoes, and that actually yields more product kind of, in shorter terms. So those things people can easily figure out, basically kind of what exactly the crops we can actually put it in that, provided that can be, we don't need to go out to buy from the shops. That takes a while, but this is a kind of start of isolation process in the go. So probably that makes sense. People actually do their work in gardens, kind of a physical activity, as well as it yields something back within a short time or a longer term.
Absolutely correct. Yep. That is definitely a phenomenal idea. I would say you've got very good ideas. Each one of them has got a lot of potential. Not everything has got a business potential behind it, but at this point, we are not looking just business and money making. We're looking for
this actually, inculcates
support the community.
This inculcates a kind of the close, the family get-togetherness, and then it's lots of bonding actually, creates, and it's kind of give and take thing, right?
Absolutely correct. I totally agree to that. People, I think, not sure whether it was in Sweden or Switzerland, and they started converting people's back garden into farms. So essentially, one of the families just growing tomatoes, another family is growing something else, and they're sharing the produce, and everything remains inside the community itself, and they don't have to go out. And all they do is they just pluck the apples, pluck the tomatoes, they fill up a basket and leave it outside their house. And then people, whoever want them, they can just come and pick up from those baskets. So the communities have already started doing it, but I think the education is still lacking. And a lot of people don't know how to actually plant just a basic thing as potato. So education can really help here.
Okay, I have a quick question. You just mentioned the 100 crore or 10 million grant. You also mentioned 1,000 crores. So I just want to clarify, is it 100 crores or 1,000 crores?
It's 100 crores, sorry. If 1,000 I said, that is my mistake.
Yeah, okay. Now the follow-up question to that is, because again, I think I mentioned this in the last call on Wednesday, the idea that I'm thinking about is related to testing, but it would only be practical to probably, so as I said, I'm working with somebody in the US, and we would initially be thinking probably of a US, UK rollout. It would obviously be, the solution would be relevant to India, but given just the scale of testing that is available over there, it may not be practical over there in the near term, but over time, it's a solution that would be relevant for a global rollout, so to speak. So in that sense, would they be amenable to funding something like that, which would probably be, more of like, let's say, piloted or tried in the US and UK, and then, once proven in these markets, because India is also, there are other challenges, logistical challenges, etc., which we perceive in India in terms of rolling it out on scale in India to make it effective.
I'll give you a simple example about India is probably far advanced in comparison to US and UK in terms of rolling out of solutions. The reason I'm saying advanced is it's just a matter of whom you're talking to. And if the solution is really going to affect the masses, then right now, pretty much every day, there are a lot of new regulations being passed every day just to avoid COVID-19 being spreading or scaling the testing, scaling of testing of the disease of the
Yeah. So as I said,
this is the key area.
my solution is partly contingent on the availability and the scaling of the testing itself, and I don't have the ability to, or the contacts to influence that aspect of it. So this will be
Sure. So you don't have contacts. We have got contacts in that area. We have got contacts even in the health ministry inside India. We can get you in connections with them. If your product is worth it, then I would say the amount of acceptance that will happen in US, you will get far quicker acceptance in India.
Okay.
That's just my perspective. I might be completely wrong, but the only thing I can do is I can get you talking to the right people straight away.
Okay.
Consulting is not making money from all these things. We are
no, I understand.
We want to introduce you. We want to be the catalyst. We can connect you to the right people. That's all what we are trying to do in this environment.
Okay. Because the solution I have would kind of tick a couple of the boxes or the points that you have. So enabling people to get back to work as well as prevention of the spread itself. So
yeah, all I would suggest is just write down a one pager so that I can send it out to the advisory board and they can start discussing further.
Yeah, we are working on that. I'm working on that with my friend. So the one pager, obviously we want to ensure that we have done enough research and the background to put that one pager or make it useful so that then
yes,
go ahead.
Yeah. Yeah, absolutely. I mean, if you have got something, any idea, that will be really, really helpful at this point. Not just to these two countries, globally.
Right.
I think it's me again, so I think.
Yes.
Number 4, enhances support for healthcare workers. All these are kind of registered and eligible healthcare workers. But down the line, they are being affected. For example, I got a friend in Spain. He said, out of 10,000 patients, 4.5K, 4,500 healthcare workers are tested positive. So this is actually graph, actually growing in a way. As I, even now, we some of us are eligible healthcare workers but not working. Is there any way to actually, approved healthcare manual that we can actually read, and we are not being completely, eligible workers, but we have some knowledge about to become a healthcare worker, or partially, we can actually help them as a volunteer.
So for that, if you look at NHS have asked for volunteers to come forward.
Yes.
Healthcare worker doesn't mean only doctors. Healthcare is anybody who's working with the patients. It's a healthcare worker. And you could be a technician, you could be just doing the admin in NHS, you could be doing the work of a nurse, or could be just providing first aid, or maybe just delivering the food. Still, you are part of the healthcare society. And healthcare is not just related to hospitals. Healthcare is also to do with elderly homes, providing care to other elderly people or vulnerable people. I'm not aware of any.
I got that. I have registered to the Good Sam. I've been actually submitted my DBS checks, etc. I'm waiting for the response from them, but it's taking a bit longer time. What I mean is, are there any manuals that we can actually read and prepare for it? Basically, kind of first aid, just like that.
First aid is definitely already available online. You can do it even on YouTube. You can do it, and I'm myself first aid certified, but just all I can do is provide first aid right now is inside my own home, because I don't have access to go outside and cure somebody else. But yes, you can definitely get yourself first aid certified. There are a lot of online. I'm not aware of any other online courses which give you a certification. But the best part about NHS is they are providing fast-paced onboarding courses. So people who are volunteering, NHS is actually providing them fast-paced training. just a 1 day or 2 day, and you're pretty much, you will start working in that department. And the rest of your training is provided on the job. So if you have got bandwidth, time bandwidth, then definitely there is a scope for that. If you think globally, then there is definitely a scope for providing these kind of trainings online, especially at remote locations, because doctors in all of the metropolitan cities, they are already being trained about how to deal with the patients who have been potential of testing positive for coronavirus. But once you are at the front line, how to collect the samples, how to do the basic consultation, those things, there are courses. Doctors and nurses and current healthcare professions are already being provided that course. Can that be made available to general public? I think that's a great idea, that if you can open up those courses and make it available to general public, so the general public can know about these basic things, and they can do self-consultation.
Yeah, that's where I'm coming from, basically.
Yes, absolutely.
That's the kind of, it's going to be a norm now onwards. It's a kind of, everyone should have a basic the eligibility of, a basic understanding of what's the personal hygiene, how to, the pandemic situation, how to deal with it. That sort of knowledge we have to have. So that might help in that kind of a business proposition as well, in a way. Also, another thing is, the food deliveries, most of them, I don't know, we are actually calling the food chains and asking them to deliver it. If we have to start a similar setup, do we need to actually go through any certification process?
I'm not sure. Give me an example.
So if I have to actually cook something at home, and I wanted to deliver it, I just want to start a food chain kind of thing. Do I need to be certified, and is there any certification courses?
Yeah, health and safety, you have to do that.
Yeah, you have to do health and safety, especially in UK. There's health and safety, hygiene. There are certifications which are required, and they're given by the council. So council provides them. So they basically make sure council visits your place. They check your working practices to make sure the way you are cooking your food is hygienic and your environment is hygienic. And then they give you a certificate, even if you have to start cooking at home and delivering food outside commercially.
Okay, on that line, so those persons, will they get any elevation of procuring the food items, or do we have any special route to procure the food items in a bulk? Because I
don't think so. There is a discrimination for that. If you are a business, there is enough groceries available outside, and the restriction of on a couple of supermarkets, they are only for the end customers. But if you are looking to purchase for your restaurant, or if you're looking for bulk buying, then there is a different supply route, and they don't have those restrictions at all. So if you're buying for your own shop, maybe a grocery shop where you're going to sell the products, then there is no restrictions as to how much quantity you can buy. Okay, so at least in UK, there is there is enough supply of everything available.
But
issue rules.
Anecdotally, what I've heard, and this is from a restaurant owner, is that you may have challenges getting supplies of certain vegetables, or because especially like the India specific vegetables, because the supply chain for those has been broken, most of them are flown in from outside. So either the prices have gone up or there's a scarcity of those. So barring that, but yeah, for your regular rice and lentils and dal and all those things, there's no issue as far as I'm aware.
That's absolutely correct, because the supply chain has been broken, and the supply chain was relying heavily on the air traffic. And because the travel industry has been impacted, pretty much all of the flights have been grounded. And that's why all of the supply which used to come even on the regular passenger aeroplanes, now that has to be shifted to the cargo planes. and the cargo planes were already running at their full capacity, and now they have to start taking up the fresh produce. So things like mango, which is an exotic vegetable, especially the UK, but everything else is definitely still available, and government is ensuring that all of the essentials are still supplied all over UK without any interruption.
And just food for thought for this community. So I was speaking to my father in India, and apparently it's a harvest season for quite a few of the crops in India. And with the lockdown and the possibility of an extended lockdown, there is a lot of there's a distinct possibility that a lot of it could get wasted. Already some of it has got wasted with some showers which caused the crops to rot because people couldn't harvest them in time. Obviously, with even labor not being allowed to move even in the countryside or in the villages, etc., this problem is magnified. If people can think of solutions along those lines, then that would also be quite helpful if there's some creativity that can be brought to that.
Absolutely. I mean, in India, the lockdown has been just 7 days right now. Not even 7 days. It was started on last Monday, Tuesday, I think. So it's not even 7 days. If there are already talks in India to restart the industries, just that they will have to be compliant now, that so that they don't just get the labors and then the labors start spreading the virus. So there are already a lot of discussions in place, not just farming, a lot of other industries as well. Some of the industries which are required to run just to support the medical staff or the current PPE requirements, personal protection equipment. So there are already discussions on those grounds. Even in UK, there are already discussions which are about restarting the economy and basically restarting the offices in a controlled fashion.
I'm the X-ray guy. In a couple of weeks, traffic will start going again, and I just think that there is a good chance for easy screening, fast screening of COVID detection, and that is where I mentioned the X-ray AI. And few things I've noticed is when people from abroad come to India, when I just inform them to go to a government hospital for detection, they actually feared going there because a lot of people with COVID are actually going to hospitals now, and they fear that they may get infected easily by going there. So I think we have to do something to actually spread people in different places so that they can reduce the crowd and have the detection done.
Naitik, I just have a quick query. Would you have or be able to source figures in terms of the PPE and the ventilators that are available in India, and how what ability do they have to scale up, etc.? Because I think that's also going to be key, and based on that, we may look at other proposals to see how we can help scale that up.
So PPE is definitely a scarcity, not just in India, across the globe.
Right.
And India especially has, the government has put a restriction on export of any PPE. So India, you might have a manufacturing plant which can manufacture masks, but you cannot export it anymore from India. And exactly the same situation across the globe, because every country has got their own need for PPE. So they are not allowing anything which is manufactured locally to be not provided locally and just be exported outside. So,
I'm looking at basically ways to help. I'm looking at data on to the healthcare workers in India. What is the shortage? Do we have any figures on those that we can access at all, or is that not available?
I don't have it in my immediate access, but I can definitely ask if you provide the exact area where you're looking for the information.
Okay.
Naitik?
Because sorry, just to complete that answer, because everybody, the government has got their figures, and these figures are updated on a daily basis. Okay, but then it's just a matter of providing the information on need to know basis.
Yeah, Naitik,
Yes.
I just posted a link from the NIC. The government of India is actually looking. If you click on that link, everyone, okay, it actually downloads a PDF. What they are looking at right now.
Okay.
That was a week ago, but it's a 39 supplies and auxiliary supplies as well. But the part A is mostly a medical specialist devices, but the part B has got something we can contribute to as well. As you said, one of them is a muscular repellent, etc., etc. So I picked up one of these, kind of started tie up with the local cloth merchant, and then started, with the local family friends with the preparing the gloves and the masks.
Yeah, absolutely. I mean, this is just the list on the PPE side, and not just personal protection. You can see there are requirements for wheelchairs, for biohazard bags as well, for safe disposal, and pretty much on all the areas. That's a great list. I really appreciate you sharing it out. And, yep, that's a good start as well on itself. I think, guys, we are coming to 1 o'clock now. Unless anybody else has got any specific questions to be discussed in this forum, we'll keep the channels open. We'll keep, just feel free to use WhatsApp, or feel free to send us a message directly to Open Consulting. If you've got a business idea that you would like to discuss and put it forward, definitely send it across. We are working pretty much the whole weekend. And on the weekdays, trying to support the bigger cause, and we can get you in touch with the right people.
Thanks, Naitik.
Thank you, guys. You have a good day. I'll just let MS type something. What's your WhatsApp?
No, I'm not typing anything. Sorry. Thanks.
Right. Ashok wanted the WhatsApp number, I think. This is my WhatsApp number. It's a tough question, Ashok. Yes. Guys, it was nice talking to all of you. This session is recorded and we'll definitely upload it straight away to YouTube, so you guys can have a look at that. So if you want, you can just subscribe to the YouTube channel of Open Consulting, and any of the videos for other sessions as well will be uploaded over there, so you can listen to it and probably forward it across to other people, maybe your family and friends if you want.